So good morning, everyone. Should we start now? So now we'll be discussing about cord blood banking and stem cell therapy. So nowadays, many companies are coming to obstetricians and they are promoting cord blood banking. So we need to know what are the actual indication of cord blood banking and in which cases we should actually advise the parents, the prospective parents to bank the cord blood. So first, what is stem cells? So the stem cells, they have a property of self-renewal. They can divide to produce the cells of their own kind, as well as they have ability to regenerate into different cell types. So stem cells can be divided into totipotent cells. So these cells can produce embryonic origin cells as well as the cells of adult lineage, like in the early stage of blastocyst. Then coming to pluripotent cells. So pluripotent cells can produce cells of only the adult lineage. And multipotent cells, they can produce cells of a specific lineage. So that they can be hematopoietic stem cells, or they can be mesenchymal stem cells, they can be neuronal stem cells. So likewise, different type of stem cells will produce cells of their own lineage. So then it is multipotent stem cells. Coming to origin of stem cells, they can be derived from embryo, that is the cord blood. So the cord blood cells are pluripotent stem cells, and the stem cells which we take from adult by the peripheral blood or from bone marrow, they are multipotent stem cells. So coming to umbilical cord blood, we know that it is a rich source of hematopoietic stem cells, and it was first used for hematopoietic stem cell transplantation in 1988 in a case of Fanconi anemia, where the umbilical cord blood from sister was used for transplantation in a boy with Fanconi anemia, and the boy was symptom-free for the next 25 years follow-up. Nowadays, stem cells, these stem cells are a source of hematopoietic stem cells therapy in around 30% of children, and it can be used for various genetic conditions. They can be storage disorders, they can be hemoglobinopathies, some immunological conditions such as immunodeficiency, metabolic conditions, and some cancers also. So in whichever disease, hematopoietic stem cell transplantation is the treatment, we can use cord blood cell instead of peripheral blood and bone marrow. Now, if some patient is not having an HLA matched sibling or any donor, in that case also we can use umbilical cord blood after HLA matching. So the advantages of this sample is that we can collect easily and it is safe to collect. This can be cryopreserved for almost 20 years. This is the only source of stem cells where there is no risk to donor, and these stem cells have a higher proliferative potential. So it has been seen that the length of telomere determines how many times a cell can divide. So the length of telomeres in stem cells which are derived from cord blood is more as compared to the stem cells which are derived from bone marrow. So if you are using cord blood, then the search time for unrelated donor is reduced to almost 12 days as compared to 3 to 4 months in case of HLA matched unrelated donor. If we are using cord blood, then the relapse rate is also decreased as compared to cells derived from bone marrow in cases of leukemia. Also, it has been seen that graft versus host disease is also, the risk is decreased if we are using cord blood. Why? Because in cord blood, there are also presence of mesenchymal cells, and these cells are known to suppress the graft versus host disease. Also, the T cells that are present in the cord blood, they are naive T cells, means they have not been exposed to any immunogenic trigger, so they are less likely to elicit a rejection response. So it has been seen that if we compare cord blood to bone marrow in case of HLA matched sibling, then cord blood is better, cord blood is comparable as compared to bone marrow. If we are comparing with HLA matched unrelated donor, in this case, the result of umbilical cord blood is superior as compared to marrow. So for pediatric hematopoietic stem cell transplantation, in case of unrelated donor, the best choice is matched umbilical cord blood. Then we can use, if matched umbilical cord blood is not present, then we can use a unrelated marrow. If matched unrelated marrow is not present, then some mismatch of umbilical cord blood can also be used.
Could you please explain this?
Like if you are not getting a related donor and then we are going for unrelated donor, then there are two options. Either we can use the umbilical cord blood or marrow. Okay. So getting a marrow from an unrelated donor, it is difficult to find, first of all, a unrelated donor. So it has been seen that the search time is more. And in case of cord blood banked in public banks, it is easier to find a HLA matched donor. Okay.
Person who's like donating to the baby.
I will come to that. Okay. So first of all, the search time is reduced. Next, due to less immunogenic potential, the result of cord blood is better as compared to marrow. So even if we are getting a matched unrelated donor, if we are getting umbilical cord blood also, then umbilical cord blood is preferred as compared to marrow. And if you are not getting fully matched umbilical cord blood, then partial mismatch will also be used. Nowadays, we are also doing transplantation with haploidentical. That is, the mismatch is there, but still they can be used for stem cell transplantation. So how we do the cord blood banking? So the blood is collected during the third stage of labor after the fetus is delivered or after delivery of placenta. So the blood is collected in a sterile bag with an anticoagulant. This procedure involves no risk to the baby or the mother, and the blood can be cryopreserved for future use. It is not advised to do banking in case of complicated cases such as twin pregnancy or in preterm birth. So around 80 to 100 ml of blood is collected in the bag with anticoagulants, and then these bags are transported to a storage facility. Then first it is checked for microbial contamination. Then testing of mother and the blood is done for pathogens such as hepatitis, HIV, etc. Then the blood RBCs from the blood are removed using various techniques, and the final volume remaining is around 20 ml. This final sample is cryopreserved in liquid nitrogen. So this umbilical cord blood, as we know, that can be preserved for many years, up to 20 years. So there are various types of banks which are available. So there are public banks and private banks, and nowadays the concept of hybrid banking has also come. So public bank was first established in New York in 1993. So in public bank, anybody can give their sample. It is free of cost, but that family will not be able to use the cord blood for their own personal use. It is mainly for allogenic use, means an unrelated person. So these donated cord blood samples are then HLA tagged, and then they are entered in database that is freely available to search. Now these samples can be used for any person who is in need after paying a minimal cost, or there may be some cost depending on the country. So it has been estimated that at present there are around 8 lakh units that has been preserved in the public banks, and the release rate is around 4,100 per year. Now coming to private bank, in this case the cord blood bank is preserved for autologous use, means for the person from which the cord blood has been taken, for that person only we are preserving for future use. Okay. Or it can be preserved for direct use by another family member, such as sibling or parents. So according to an estimate, around 40 lakh units are preserved in a private blood bank all over the world, and the release rate is around 130 per year. So as you can see, the number of units in private banks are much more as compared to public, but the utilization in private banks is less as compared to public bank. Now the concept of hybrid bank has also come. In this case, initially for a few years, suppose 5 to 10 years, the sample is stored as a private banking, and then the same sample is transferred to public sector. and the cost is not taken after that period of time. So these are the advantages that are associated with each type of banking. The public banking is free of cost. The samples can be searched internationally. The standards are usually high quality because they are maintained by the government setup. And in these public banks, we can find rare HLA types. The disadvantage is that the funding is needed from the government. So it is not available in every country, and it may not be available for all females who are giving birth in every center of that country. Sometimes in these cases, the cord blood may not be available for the donor or his family. In case of private banking, the access is exclusive for the family members who have donated the cord blood. It is readily available in case the need arises. The disadvantage is that the cost is paid by the parents and it is unavailable to general public. Nowadays, the current indications for autologous use, means use by self, are very limited. So the use of private banking is limited in the current scenario. Now coming to hybrid banking, so there are various models. It can be sequential hybrid banking, means initially the cord blood is stored as a private mode, but then it is made available to public. Parents can decide whether to release the cord blood or not. The disadvantage is that re-consent is needed from the owners when we decide to shift from private to public. The storage cost is taken from the parents. Then there are other models such as split model in charitable family banking. The money is raised by charitable work, and then there can be public-private integration. So the limitation of cord blood is that the collection, storage, and processing needs expertise. The amount is limited. So we are taking 80 to 100 ml, but from that, the final volume is around 20 ml. And the amount of cells that are present in the cord blood are sufficient for hematopoietic stem cell transplantation, mainly in pediatric population, if the weight of the child is around 10 to 15 kg. For adult, the quantity is usually insufficient. Because the number of cells is low, it may lead to delayed recovery. And because of low number of cells, there can be high chances of graft failure. So there are various facts and myths which are associated with private banking. So the companies are projecting it as a cure for several genetic and acquired conditions in future, and they are claiming it as a source of biological insurance. So coming to each type of disorder, such as genetic disorders, including hemoglobinopathies such as thalassemia, hemophilia, and storage disorders. So for these disorders, the cord blood cannot be used for the same person, as it will have the same genetic mutation as the individual. So for that person, if the fetus, we are storing the cord blood, and after 6 months, we come to know that the baby is having thalassemia, then the cord blood cannot be used for that person because that will have the same mutation causing thalassemia. Now for malignancies, in this case also different stem cells, that is allogenic, means from different person, the stem cells are preferred over autologous stem cells, because when we are using allogenic stem cells, there is immunological reaction. So that immunological reaction is helpful in cases of leukemia. So in this case also we will prefer allogenic transplantation. Now coming to next indication, that is high-risk tumor. In case of high-risk tumors, the autologous stem cells can be used, but in this case also the stem cells can be harvested from the same individual because the malignancy is limited to a particular organ. So from the peripheral blood or from the bone marrow, we can still take the stem cells from the same individual. So none of the indications, autologous stem cells are beneficial. Then comparison between public and private banks. So the chances of utilization are 100 times more in public banks, and advertisements by private banks are usually misleading. So that is why in some countries like France and Italy, private bank and any advertisement related to private cord blood banking is deemed as illegal. Now coming to few indications that are there for private blood banking, umbilical cord blood banking. So if there is an existing family member with a disease that is known to be treated with stem cell transplantation, such as leukemia, hemoglobinopathy, bone marrow failure, thalassemia. So if elder sibling is having thalassemia, and now we want to do cord blood banking for another child, so that is justified, because if the fetus is HLA matched, then that cord blood can be used for stem cell transplantation for the elder sibling. Okay. But in this case also, we will first do the HLA typing, and if HLA typing is not matched, then the cord blood will not be used. Now for other family members besides sibling and parents, the cord blood cannot be used, because anyways the HLA matching will not be done, there. So the umbilical cord blood cannot be used for extended family members. Now coming to role of umbilical cord blood in regenerative medicine. So what is regenerative medicine? In this, the stem cells are induced to differentiate into various cell types. So it can be induced to differentiate into muscle cells, neuronal cells, cardiac cells. So now they are saying that in adult onset disorders such as Alzheimer's, dementia, or in case of spinal cord injury, these type of stem cells can be used that will lead to regeneration of the tissue that has been injured. But for these cases such as diabetes, birth asphyxia, spinal cord injury, MI, the studies are still at the preclinical level or in phase 1 and 2 trial, and there is no documented evidence as such. And this is not a part of standard care. And ICMR has issued guidelines that recommend that there are no approved indications for stem cell therapy other than hematopoietic stem cell transplantation, that also in selective conditions. Now there are certain recommendations by various committees. So American Academy of Pediatrics in 2017 said that cord blood should be discouraged for use by the same family and public cord blood banking should be promoted. Then American College of Obstetrics and Gynecology in 2015 said that cord blood banking should not be projected as a biological insurance. Then in 2017, they issued a statement about the benefits of delayed cord clamping. So they said that if the family is having any previous child which is affected with a disorder that could be treated with transplantation of hematopoietic stem cells, then only cord blood banking should be done. Otherwise, the benefits of blood transfused to the neonate is more as compared to blood that is stored for future use. Now, ICMR has also issued guidelines on stem cell research. So they have said that use of stem cells for any therapy which is not approved other than for clinical trial will be considered as a malpractice. Okay. So for medical professionals, they should have an adequate knowledge about the utility of cord blood storage, what are the different types of storage facilities, and what are the ethical issues concerning storage. So the conclusion is that the umbilical cord blood transplantation has been approved for only certain conditions where hematopoietic stem cell therapy is the accepted form of treatment. There is no utility of cord blood banking for the same individual in later part of life. Projecting this cord blood banking as an insurance against all diseases should not be done. And public cord blood banking should be encouraged so that if there is any individual who is in need of transplantation and is not getting an HLA match donor, should get a match. Private cord blood banking should only be done in cases if there is a child in a family with a disease that can be treated with hematopoietic stem cell transplantation. So that is the end of it. Thank you.